Hi, my name's Andreas and I'm Director of Audiology at Hearing Solutions, and I'm here today to talk to you about cleaning and maintaining your hearing aids. The average hearing aid lasts somewhere around 4 or 5 years. 4.2 years is one of the more recent studies. However, that's not just because of wear and tear, that's also because a number of people are choosing to change their hearing aids as new technology becomes available. If you're taking good care of your hearing aids, they can last a long time. They're even weather resistant to dust and moisture to a large degree. That being said, the most frequent reason why patients come in with hearing aids not working is because they haven't been maintained at home. Perhaps they have some wax buildup, or they just haven't been going through their regular cleaning and care maintenance. So I'd like to go over that with you today. Some individuals are a little bit fearful of cleaning their own hearing aids. They've invested a lot of money into the process, and they're maybe nervous about breaking a fragile piece of technology. I want to assure you the hearing aids are designed to be cleaned and cared for at home, and so you shouldn't have any worry. They're also covered under warranty, and so even if something should go wrong, they'll be covered under warranty even if you were to accidentally damage it. But again, I think that's highly unlikely, and let me show you how and why. I'm going to show you a number of different receiver in the ear hearing aid styles, as this is the most commonly used device today. With this style of hearing aid, sound is coming in through microphone ports on the back. So on this device you can see there's two little ports here with one of the microphones and another port down here for another microphone. Having multiple microphones is one of the ways the hearing aid is able to reduce background noise. Sound gets processed in the device, comes down the wire, and then the piece that's in the ear is actually the receiver or the speaker. These are the two components that we want to spend most of our care cleaning. The best time to clean your hearing aids are when you take them out at night. At this time, wax is soft and it's easiest to wipe any wax buildup on the hearing aid off. And so I'm using a little microfiber cloth. This typically comes with the hearing devices. That being said, an eyeglasses cloth is a similar tool that can be used. And we're using that to wipe away any wax or buildup that might be on the tip of the hearing aids. It can be also used to wipe the body of the device off so that any residual oil is wiped away, as any residual oil can allow dust and other debris to accumulate within it. When we're ready to put the hearing aids in the morning, this is the best time to use a tool like a brush to clean the hearing aids, as any residual oils or waxes have dried at this point. And so we can take the brush and use it to brush away any wax or accumulation on the device. We can also brush those microphone ports. You'll notice that I'm holding it in a way that gravity is working in my favor, so any dust or debris is going to fall away from the device. There's also a tool that has a little wire pick at the end of it. We can use that wire pick to go in the tip of the rubber dome that's on the end so that any wax that's gotten in there can also be pulled away. You don't have to spend a long time doing this maintenance. A few seconds a day will go a long ways in terms of daily care for your hearing aids. Now, if this daily maintenance wasn't enough and something were to go wrong, the number one thing that we would want to do is change either the rubber dome that's on the end or the filter that's behind. Let me show you how. So the rubber dome on this device can be peeled away. And so if we peel it away, we can see that there's a little wax filter hiding behind this device. These come in a variety of different packages. So if we open up this package, you can even see that there's instructions within. On this one, we're going to rotate the wheel, and that allows there to be a little receptacle beside the garbage can. That's where we're going to dispose the old filter. So you would take the receiver or the speaker in your hand, and you would insert it into where that garbage can receptacle is, and you can see that it has extracted the old dirty filter. It's used up and it's garbage now. In the stage 2, there's another filter ready and waiting for it. We would just insert it, it snaps into place, and then there's a new clean filter ready to go. We then place that rubber cap back on, and it goes over top. There's no hard, fast rule as to how often you should do this, but certainly anytime the device doesn't feel like it's working correctly, we would want to change that filter. These rubber domes are made out of medical grade silicone, and so they'll last often for a year or longer. That being said, if it looks like it's torn or damaged in any place, or it feels like it's too dirty to be able to be cleaned effectively, don't try to reuse them or clean them yourselves. Just replace them altogether. New domes will come in a variety of different shapes and sizes, but the principles remain the same. We would just take a new dome out of the package. The old one can be peeled off, and the new one is just placed over top until it feels nice and secure. When it's on there securely, it won't fall off at all. Different manufacturers might manufacture some of these components a little bit differently, but the principles are the same across different manufacturers. Even if your dome looks different in appearance or shape, the principles remain the same. You peel the old dome off, and you can see that another little filter is hiding underneath. For this manufacturer, they come in a slightly different package. You open it up, pull out one of the filters, and you can see the same principle. You can see there's a little prong here to remove the old filter and a new filter on the other side. We would insert the prong into the speaker or receiver, pull it out, flip it over, and insert a new filter into its place. Then you can either reuse the rubber dome if it still looks like it can be used, or replace it with an altogether new one. Again, putting it over top and pushing it on securely to a point where it's not going to come off. The different styles of domes are cleaned in the same manner. So we can use the brush to brush away any dry wax or dirt. We can use a little wire pick to pick out any wax that's in the tip. And we would use the cloth when we take the device off to wipe away any residual dirt. Looking at a third manufacturer, again, all the same principles. So we have microphone ports at the back, here and here, and we have the speaker or receiver at the end. We peel away that rubber cap, and we expose one of those filters. The packaging in this case looks slightly different, but the principles are, again, exactly the same. We use the prong to remove the old filter. We flip it over, and we replace it with a new one. And this is garbage. We wouldn't try and reuse that again. We take the rubber dome, and we put it on. You can see I've selected a device here that has an extra little wire strip here. This is a retention lock or a sport lock. This is designed to help keep the receiver or speaker in the ear properly and keep it from moving around too much. When you're cleaning it, it's possible on some devices for this sport lock to fall off. If you've noticed that's happening, just check the orientation and compare it with the other ear. We want it going in a way that it's curling and matching this downward angle like that. If you were to have inserted it upside down, there's a good chance it would be facing the other way. Now that we've shown you how to clean a receiver in the ear hearing aid, which is the most common, I want to show you how to clean and care for some of the more custom styles of hearing aids. So on some of the devices I've just shown you, the receiver or speaker that's going into the ear has a non-custom tip. Some of the reasons why we would choose a non-custom tip is that it's often more comfortable, there's less in contact with the ear, and so when it's more comfortable that way, people are more likely to wear it and find that they're not noticing that they're wearing it, which is a really good thing to promote use. The other advantage is it's allowing sound to pass into the ear more naturally, and so it's often our intention to use this more open style of hearing aid as it presents more natural sound quality and more comfortable feel. But depending on an individual's hearing levels, this rubber dome might not be sufficient. And so in those cases, we would manufacture a custom mold. The custom molded tip on the end allows for the ear to be closed off and allows us to keep in some of the bass sounds a little bit better. And it also allows for better retention depending on the geometry of one person's ear compared to another. The cleaning principles on cleaning this style of hearing aid are roughly the same. So we have the same microphones on the back of the device, and that's cleaned in the exact same manner, wiping it down and brushing it the exact same. The only difference is we're cleaning the receiver or speaker slightly differently. So we're still able to use the cloth, so when we take it off at night, we're able to wipe it down and remove any excess wax or oils. When we're ready to put it in the morning, we're able to brush away any dry wax. One of the added steps, however, is that there's a vent in this style of hearing aid. And so you can see that there's a channel passing from one side to the other side. The size and shape of that channel is going to vary based on one person's ear to another, as well as their hearing levels. We may choose a bigger or smaller vent depending on one individual to another. However, wax can accumulate inside of that vent. And so for that, we have a little pipe cleaner-like tool. And so you're able to put those pipe cleaner tools in one side and they come out the other side. And when you're seeing it come out the other side, you know that it's cleaned it fully. They come in different sizes because it depends on the size of the vent. If you have a very narrow vent, you're going to need a very narrow pipe cleaner. If you have a larger vent, you're going to be able to use the pipe cleaner that's larger. Use whichever pipe cleaner fits in without too much pressure or forcing it. If this vent should become blocked, the hearing aid will still function. However, it's going to feel more plugged in the ear, and it's going to let less sound come in naturally. So it's going to affect the sound quality as well as the comfort of the device. People will also find that their own voice might sound trapped in their head and might sound a little bit more boomy. And so we want to be able to clean that vent periodically as well. If you make that a part of your daily cleaning routine, you won't have to worry about it. The little tip has a filter. On this style of device, because there's no rubber dome protecting that filter, the filter is going to need to be changed a little bit more frequently. The principles are exactly the same. We open up the filter. You'll see there's a little prong to extract the old filter. Push it in, it pulls the old filter out, and then we just replace it with a new filter. So a custom receiver in the ear hearing aid is cleaned in much the same fashion as a device using a dome, just with a couple modifications for cleaning the custom tip. Custom hearing aids that don't have a piece behind the ear are going to have, again, the exact same principles in terms of cleaning the vent, as we have a vent coming in one side and exiting the other. And we have a receiver built into the tip here that has a wax guard. The only differences to consider is on this style of device, we have to locate where the microphones are. So we can see a microphone port there and a microphone port there. Cleaning of this device is very, very similar. So in the evening when we take it off, we would use the microfiber cloth to wipe it down and remove any excess oils or wax from the device. And then in the morning when we're ready to wear the device, we would take the brush. We could brush those microphones so that any dirt, dust, or debris can fall away, as well as the body of the device and around those vents. You would then take one of the pipe cleaners and work it through the device to make sure that that vent isn't blocked. In terms of changing that filter, same as before, you're changing it as needed. There's no rule to say how often you should change it. Some individuals will find they need to change it roughly once a week, others once a month or even longer. But if you find the device doesn't seem to be working properly, we definitely want to change that filter. It's done in the same fashion. Take out one of these sticks. We use the prong to remove the old filter, pull away, flip it over, and replace it with a new filter. These custom devices come in a lot of different shapes and sizes. And so the principles are the same for all of them. Even if your device doesn't look exactly the same, we can follow the same principles. We can look on one side and locate the vent and the speaker, and look on the other side and locate the exit for the vent, as well as the microphone. In this case, there's only one microphone on this device, as it's a smaller device. We wipe it off and we take it out at night. And then in the morning, we're using the brush to brush it. Now again, if you don't have these exact tools, you can get them from the clinic or use an old toothbrush and an eyeglasses cloth, and they'll do the same trick. Pipe cleaner goes in one side and out the other. The last style of hearing aid that we want to cover today is a behind-the-ear hearing aid. So the principles on this style are very similar. On the back of the device, we're going to locate the microphones. So we can see one here, and then we can see two other additional ports at the top there. On this device, the speaker or receiver is actually built into the body of the device. And so sound is being channeled down this tube, through an ear mold, and into the ear that way. Cleaning it, when we take it out of the ear at night, we're going to use the microfiber cloth to wipe down any oils or debris. And we can do that on both the ear mold as well as the body of the hearing aid itself. Then, in the morning, we're able to take the brush and brush away any dried wax or dirt. You can do that on the device itself as well, and we're brushing it in a way that any dirt is going to fall away from the microphones. That daily maintenance is generally enough. With this style of hearing aid, it is possible for moisture or wax to get inside of the tubing itself. And so in that case, we would want to separate these two components. So we're leaving the hearing aid component off, and we're just looking at the ear mold itself. You can use some sort of pipe cleaner, or you can use a blowing tool, inserting that in the end and blowing any moisture or wax through the tubing. You can also use some sort of a pipe cleaner to clean out that tubing as well. When you're ready to put it back on, we just insert it. Now you do have to make sure the orientation is correct. If I were to have turned this, I could be facing it the wrong way. So looking at the device, we want to make sure that that ear mold is facing towards the ear. Typically the writing on the front of the mold is facing forward towards the nose, and that's going to be the correct orientation to put it back in the ear. Some of these ear molds are designed with a vent and some are without. So this style here doesn't have any vent included, whereas the second one I have here does. They can be made out of a silicone material or a harder lucite material. The cleaning principles are the same. However, with some of these softer silicone materials, you'll notice they will start to discolor over time. And so as they take on a yellowish or brownish color, they may be getting impregnated with some of the oils from our body. And so even if you're doing a good job cleaning it, they may discolor over time. If your device has a vent, we would use one of these pipe cleaner tools to go through the vent and ensure that that vent isn't blocked with any wax or debris, as that's going to affect how it feels in the ear as well as how sound is able to pass through that vent. Over time, this tubing will begin to harden and it may discolor as well. And so if you're finding it's very difficult to remove it from the device, from the ear hook, you may need to visit the clinic and have that tubing replaced, as it's normal for that tube to need to be replaced roughly every 6 months to a year. With a few seconds of care each day, you'll be able to reduce how often you need to visit the clinic, and you'll be able to prolong the life of your hearing aids.